I'm Heidi Murkoff, author of What to Expect When You're Expecting. Millions of moms and dads have turned to What to Expect for advice on how to have a more comfortable and less stressful pregnancy, a safer delivery, and a healthier baby, which is more gratifying than I can ever begin to tell you, but which isn't enough. Too many families in our country don't know what to expect when they're expecting, and they have no way of finding out what they need to know. Did you know that the United States infant mortality rate is higher than that of 27 other countries? Did you know that a mother's ability to read directly impacts her child's success in school? We've created the What to Expect Foundation to help educate and empower underserved expectant families so they too can expect healthier pregnancies, safer deliveries, and healthier, happier babies.
Across the country, nearly 1 in 6 Americans has difficulty reading. But how does reading connect to healthcare? A staggering number of adults, almost 90 million Americans, have significant problems understanding basic health information. And for pregnant mothers, their struggle with low literacy directly impacts the health of their babies.
There are dramatic consequences when you look at the low health literacy of pregnant women and moms. If you look at less educated women, the rates of low birth weight, of infant mortality, the likelihood of having a sick child are much, much greater.
To improve pregnancy outcomes and to activate and empower mothers, the What to Expect Foundation created the Baby Basics program. First, we give moms the Baby Basics book, a colorful month-by-month pregnancy guide written to a 3rd and 5th grade reading level. Available in English, Spanish, and Chinese, with other supportive materials available in 14 languages. Then, we work with healthcare providers and community-based organizations to bring Baby Basics alive.
We've been working with clinics, home visiting programs, managed care plans. Everyone who touches a pregnant mother's life has been coming together to work to build programs where we can teach moms not just about their prenatal care, but also how to ask questions, how to be empowered to become their own and their family's best advocates.
The perinatal community has embraced Baby Basics in dozens of programs across the country. The program is designed to be flexible and works in both clinical and education settings, adaptable to meet each community's needs. Here's how it works.
We invite all moms to come in and they work with us. As soon as they walk in the door, we provide them with a Baby Basics book and a planner.
It comes with a plan inside, okay? It's a very helpful book.
We kind of explain how the Baby Basics program works, how the planner takes them through all of their pregnancy and beyond, and how it's effective during their visits. We then pass it on to the clinical, who does more of the blood pressures, weight, so it gets a little bit more intimate. And so then again, they're able to get in detail with more of the questions and the concerns. Is it silly for me to ask this question? Should I ask the provider this question? Does this make sense? It also prompts the clinical person to tell them, jot that down in the book.
Today I'm going to talk to you about this book, what's in the book, how it can help you, and all about the Moms Club.
During the time mothers wait to see the nurse, doctor, or midwife, the clinic holds Baby Basics Moms Clubs in the waiting room. These clubs teach moms how to have a healthy pregnancy, help them develop health literacy skills, and give them the opportunity to find support from each other.
And that's okay.
Baby Basics is different in that it's not at a teach-at method. You know, it's not lecturing, it's not conferencing. It's a really interactive, module-based group of education that comes out of this book. So you're actually able to break it down. It becomes fun.
You have the planner?
Moms Clubs can be run by health center staff, or community-based organizations can send their educator or home visitor to teach in groups or one-on-one. With Baby Basics, everyone providing health education is on the same page, using the same book and curriculum, and writing things down in the planner, which coordinates everything for mom and prepares her for appointments with nurses, midwives, and doctors.
Baby Basic has really changed the way that I work with my patients and how I educate them about their pregnancy. Now, do you have any other questions for us?
I had a question about the baby moving.
Baby Basic is a great time saver because up until that point, I had to review everything individually with the patient. It extended the time that the patient spent with me on a one-to-one. I had to research and look for the materials that they may need at that particular point in their pregnancy because you never know what the patient's going to ask for. Baby Basic has it all in one place. All I have to do is look at the chart, find the page that that material is on, and indicate that to the patient. Here it tells me that we can begin on page 89, and it tells us that you probably won't be feeling anything for about another month. And then it gives them the opportunity to go back and do some self-exploration, really learn for themselves and be part of the process. So it's cut my time in educating a patient dramatically, and yet I know that they're getting everything they need. The Medicaid program has really strict guidelines for standard of care, one of which covers education of a pregnant woman. And there are criteria that have to be met. Baby Basic meets each one of those criteria. It covers each and every single point that's covered in that standard of care criteria. So we are always in compliance. It gives us 100% compliance, and we never have to worry about that again. So I think that that is one of the best pluses that this program offers.
The program continues into the doctor's office.
We're using the program not only in the clinic but also with our home visitors. And what I have found is that implementing a structured Baby Basics program has really helped to streamline my office visits. Does that make sense?
Yeah.
Okay. Patients know what they want to know when they come to the office, and they're better able to ask questions and confirm that they understand things.
If I start feeling contractions, if they continue after I'm walking or they get worse, they're probably real.
Perfect. All right, so you answered your own question.
Good.
A lot of patients' health education, health information, if not most of it, was actually coming from my nursing staff, my medical assistant staff, my front desk staff. And by tuning all of those people in to the same Baby Basics channel, I know that the health information that goes to my patients is consistent and valuable information. All right. We're just now starting to learn the impact that stress has on prematurity and poor birth outcomes. We all know that psychological stress can cause physiologic problems, and by creating an environment where moms are comfortable addressing their stress by voicing their questions or their concerns, I think that you're alleviating some of their psychological stress and hopefully addressing some of the physiologic stress as well.
Most underserved moms cannot afford and may not be able to read a pregnancy guide. But research shows that giving moms the Baby Basics book and helping them read and understand it has a real impact on birth outcomes. For example, the Baby Basics program in New York City helped Ebony Perry. She says it saved her baby.
I felt really under the weather, and I started to feel cramps. So just as a precaution, before I started to panic and call my nurse, I opened my Baby Basics book. And it just so happened at the page I opened, everything I was feeling was in the book as warning signs of preterm labor to call your physician immediately. I called my nurse and I told her, I just looked in my book, I'm feeling these things. She said, go straight to the hospital. If it wasn't for my book, my son probably would have been born premature.
Ebony realized the power written words had in helping save her child, and that Baby Basics was the catalyst that changed her life. Pregnancy is one of the most teachable moments in a mother's life, and when moms discover books help them, they want to continue reading for themselves and to their children.
It's good for you and can help your baby stay healthy.
Because of the book, I read everything now, newspapers, everything. So the book really, really helped a lot.
Que el bebé tiene 8 meses.
With more and more healthcare providers participating in the Baby Basics program, Ebony's story is far from unique. Hundreds of mothers have seen dramatically improved health outcomes for their babies. Benefits for the medical community implementing a Baby Basics program result in engaged patients who now receive far more comprehensive, economical, and coordinated care. Great for the babies, great for the moms, and efficient and compassionate for the providers that take care of them.
We always strive to give our patients a voice. We feel like the underserved needs a voice. And so to have an instrument and a tool to assist us in providing them with the literacy, empowering them with the ability to know and be able to utilize that knowledge.
I've seen patients clutching the book, loving the book. I've seen the dads reading the book furiously in waiting rooms and commenting. And I had one mom in particular who told me that she used to read it with her kids at night to help prepare them for the birth of their sibling.
To be a part of providing that education and information and to be a part of that empowerment is a gift that they give to us, and for the small gift that we give them of Baby Basics.